Welcome to Integrity Linguistics Institute.
Gardner, and I'd like to talk to you today about some research I've been involved in concerning something that affects all health professionals: staff-patient communication. Now, firstly, let me reassure you that in feedback, patients seem positive about the way information is communicated to them. But I recently decided to explore the issue in more detail when I was in a hospital with a patient and witnessed for myself what can result when a healthcare professional assumes they've made themselves clear to a patient, when in fact they've been anything but. Luckily, I've had very few complaints made against members of my team, but the potential is certainly there.
All right. So that was the audio script. So let's go through that in simplified terms. Okay. Good morning. I'm Dr. Keith. So what's the answer? Okay, so I'll do one thing. I will play the audio once again. So just for easiness. The audio script.
Good morning. My name is Dr. Keith Gardner, and I'd like to talk to you today about some research I've been involved in concerning something that affects all health professionals: staff-patient communication. Now, firstly, let me reassure you that in feedback, patients seem positive about the way information is communicated to them. But I recently decided to explore the issue in more detail when I was in a hospital with a patient and witnessed for myself what can result when a healthcare professional assumes they've made themselves clear to a patient, when in fact they've been anything but. Luckily, I've had very few complaints made against members of my team, but the potential is certainly there.
All right. So now what's the answer? So play the audio 2 times. So it doesn't matter whether it is an incorrect answer. The most important thing is that you try to choose the answer option which you feel is the best answer option. All right. So I'll give you 5 more seconds. Okay, good. All right. So it is nice to see maximum participation. All right. So let's take a look into the question over here. Right. So what is this question type? It's a reason or a motivation type question, right? See, the question is asking you, is telling Dr. Gardiner. So this is the person who is giving the presentation. He first became, so see, every single word over here is extremely important. So first, that means what? The initial stage. Okay. So in the very, very beginning, Mr. Gardiner, in the very beginning, okay, he became interested. Okay. So there was some event over there, and that event triggered an interest, okay, in staff-patient communication. Okay, after, so see, there was a triggering event. And that triggering event happened in the very beginning. Okay, and that triggering event was the reason, or we can say the motivation for his interest in this particular topic, that is effective communication between patients and medical staff. So what is your duty here? Your duty is to identify what was the reason or what was the triggering event that motivated him to become interested in this particular topic. So how should you prepare yourself? See, why am I discussing about the questions extremely important? Because you need that clarity. Because if you're simply reading the question, simply reading the answer options, and simply listening to the audio, you're listening to every single thing they're saying, and you will not be able to ignore the useless information. Because in this particular question over here, if you have that focus, if you have clear-cut idea on what is important to you, then you can basically ignore a huge chunk of the audio which is completely useless. So I'll tell you the distracting information. Okay, now anyway, let's come to the answer options over here. So we have 3 answer options, A, B, and C. Now, these are all possible events or possible reasons over here. So he first became interested in staff-patient communication after experiencing poor communication as an inpatient. So he is telling that he was an inpatient himself, inpatient, outpatient, IPOP, very, very basic, right? IP means what? A patient who got admitted into the hospital. So here he is telling that he got admitted. Okay, so this gardener over here, he once became a patient. He became an IP patient. And when he was a patient, he experienced very poor communication with the staff. And that triggered his event. Okay, that triggered his interest. That was the motivating factor in developing this interest in staff patient communication. Like, okay, you must be able to understand. Now, what is answer option B? Observing the effects of poor communication on a patient. So now what is he doing over here? He is telling he observed. That means he witnessed. Okay, he observed basically means he witnessed. So what did he witness? He observed the effects of poor communication on another patient. So he was seeing another patient suffering because of poor communication with the medical staff, right? That is answer option B. Now, what is answer option C over here? C is telling analyzing patient feedback data on the subject of communication. So now he is telling he analyzed feedback from patients. So usually you give surveys, right? We give surveys to people like how did you like the hospital? How nice was the hospital and all. So they gave surveys and they got feedback data. So what is he saying? He analyzed the feedback data and he understood that people are not satisfied with staff communication. And that was the reason, that was the motivating factor for his interest in staff patient communication. Right. So again, so what we have just done right now is what we call as the keyword analysis. All right. So what we just did now is keyword analysis, which is part of comprehension, right? That is understanding the question. Now, what we have to do, we have to register the information to our memory. You must not forget what you understood, because when you're listening to the audio, your eyesight should only be in the answer options. Your eyesight should not be in the question. Now, when it comes to detection, right? So detection is where you eliminate the incorrect answers and choose the right answer. So what is the strategy here? The most effective strategy is the elimination strategy. That is, you must be able to eliminate the incorrect answer options one by one. And one of the most important strategies for that is the verb analysis. That is, you must be able to identify the focal point of the answer options, that is the verbs, and that will usually help you to understand the main focus of the answer option. So anyway, let's talk about the verb analysis. So what is the verb in answer option A? What is the action over here? Experiencing, right? So what did he experience? He experienced poor communication as an inpatient. So he himself was an inpatient and he experienced this. And because he experienced that, he became interested in this topic. So see, this is the verb over here. This is the action, right? Now, what is the action in answer option B? Here, the action over here is observing the effects. So what is the action here? He observed the effects of poor communication on another patient. So there was another patient over here, and in that patient, he observed the negative impacts of poor communication, and that made him interested in staff patient communication. Now, what is answer option C? What is the action over here? What is the verb over here? Analyzing patient feedback. So what is the verb over here? So he studied patient feedback, and that made him develop an interest in this topic, that is staff patient communication. Now you see over here, very three long sentences, like three very, very long sentences. What have we done? We have cut short into small, tiny things. Experiencing as an inpatient, observing the effects on another patient, analyzing patient feedback. So like this, you have to register this information to your mind. Again, it takes time. Okay, so don't expect to become a professional from day one itself. The more you practice, the more the good you become. So it is nothing but the law. It is called the law of practice. Okay, so I don't know if I have said this. It is a law. Whether you like it or whether you don't like it, it will happen. See, for example, it is the law of gravity. What is the law of gravity? If you jump from the 14th floor, what is going to happen? You are going to fall down. You're not going to fly like a bird. It is okay. Whether you believe in gravity, whether you don't believe in gravity, the law of gravity is going to work. So similarly, you can have so much of self-doubt and all, no matter what you believe about your practice. If you practice smartly, again, smart work, if you practice on a consistent basis with commitment, whether you believe or whether you not believe, you will excel in all these kind of things. Right, that is a law of practice over here. Yeah, dead. Right, 14th floor can be quite dangerous. Yes, very good. Right, so we have understood the keywords, we have understood the verb analysis as well. So now what you have to do, you have to register all this information to your memory, right? Because now we are going to listen to the audio. So when you're listening to the audio, remember, they will try to distract you. So you must not distract yourself. So now your eyesight should only be in the answer options. Okay, when you're listening to the audio, the memory of the question should be there. What's the memory of the question? Why he became interested in staff patient communication. That memory should be solid. Okay, and the verbs also should be there. The verbs: experiencing as an inpatient, observing on another patient, analyzing patient feedback data. So these three things should be there. And then you have to listen to the audio, and you must be able to distract the useless information coming from the audio. And again, you have to wait for signal words. Remember when I told you the OET will always give you a signal just before the answer comes. 99% of the times they will give you a signal before the answer comes. So as soon as you heard the signal word, then you have to become alert and you have to choose the right answer. Right. So now let's take a look into the audio script. All right. So this is the audio script over here. So remember what the question is asking you. There was a reason. So what motivated him to develop an interest in staff patient communication? So let's see what he's saying. So he's saying good morning. Okay, so we also good morning. He's saying, okay, my name is Dr. Keith Gardiner. I would like to talk to you about some research I have been involved in concerning something that affects all health patient professionals, staff patient communication. Now you see over here, this is just a background information. Okay, it is just a background information over here. And it is nothing but a distractor, we can say. Okay, it is just building up to the answer. Okay, it doesn't have any much importance. So again, there is no signal words over here. We are waiting for a signal word. That is the reason why he developed interest in one particular topic. So you can say, okay, this is not at all important to us. Now let's see what he is saying in this portion over here. So now he is saying, now, firstly, okay, now see, this is very important, okay, because in the audio over here, in the question also, Dr. Gardiner first became interested. So here it is, first became interested, okay, so that is what we want. In the initial stage, what made him develop an interest? So here also the same word is coming, firstly. So, okay, let's be alert, but it has to be connected to the word interest. But what is he saying? Now, firstly, let me reassure you that in feedback, okay, so now he is not talking about his interest over here. He is just talking about a reassurance that he gets from a feedback, right? So feedback. Now, in which answer option did we hear about feedback? In answer option C, right? Now, see, the very first 1 or 2 seconds, the very first 1 or 2 seconds itself, the speaker over here is talking about answer option C. Now, this is why I'm telling you, when you are listening to the audio, if you're reading the answer, if you're reading the question, then you will miss out on this word over here, that is feedback, because you're so busy reading the question. That is, you're distracting yourself. Okay, so don't do that. Always try your level best to register the information to your mind. And when you're listening to the audio, always keep your eyesight in the answer options, because usually they can come directly to the answer option. So now your eyesight, because the keyword of yours is feedback, right? So now your eyesight should be in answer option C. So here, analyzing patient feedback data on the subject of communication. Now let's see whether analyzing the feedback was what made him develop an interest in this particular feed. So he's telling, let me reassure you that in feedback, patients seem positive about the way information is communicated to them. So see, what is this telling over here? From the feedback, he is understanding that patients are actually positive. Okay, that is, everyone is saying, yeah, staff is communicating to me very nicely. Okay, there is no problem. So that is what he's saying over here. Now he's saying, but I recently decided to explore the issue in more detail. Now see over here, now he's saying, I recently decided. Recently, that means in a short span of like not too far away, he decided to explore the issue. Now, see, he decided. Okay, so he took a decision. Okay, so he took a decision to explore the issue in more detail. Now, what is the issue over here? Patient communication. When I was in a hospital with a patient and witnessed for myself what can result when a healthcare professional assumes, okay, when a healthcare professional assumes assumption, that means guess, they have made themselves clear to a patient, when in fact they have been anything but. Now, this is very advanced English, especially in the last portion, but I'll tell you why. But anyway, okay, so I'll explain the audio script to you, those who didn't understand. But over here, I want to bring in the distracting information. Now, see over here, this entire portion. Okay, this entire portion is not important to us. Okay, because over here, what are they saying? It is just a background information. They are just telling, okay, this is my name, this is what I do, this is what I'm talking about. Now, here also, let me just reassure you on the feedback. The feedback seems positive about the way information is communicated to them. Now, here also, until here, we are not getting any information that is explaining why he became interested in this topic. Now, see, why are you listening to the audio? You are listening to the audio to find out what made him interested in this topic, right? But till here, okay, from here to here, we are not getting any information from the speaker as in which he is claiming that this is the reason why I became interested. Now, from this portion, he is saying, but I recently decided to explore. Now, see, now he is explaining. Now he is giving an explanation that why he decided to explore the issue in more detail. Now your mind should become alert because now he is giving you the reason, okay, why he took a decision to explore the issue in more detail. So now you have to say, yes, this is the signal. This is the signal that the OET is going to say the answer. As I told you, 99% of the time, just before the answer, the OET will give you a signal. If you are able to identify the signal, then it becomes quite easy. Now see, he is giving the reason. Okay, what made him take a decision to explore the issue? Now, what is the issue over here? The issue over here is information communication. Okay, so that that ability to connect the words is extremely important, right? So anyway, now what is the saying over here? What was the reason? What was the event over here? When I was in a hospital with a patient, so he was in a hospital with another patient. Now your eyesight, okay? Now where is your eyesight going to go? Now your eyesight was in answer option C. It was an answer option C because we talked about feedback. Okay, now over here, they did not say anything. So analyzing patient feedback, this is mentioned. Okay, so analyzing patient. So is he saying analyzing patient data over there? Yes, this is completely mentioned, right? In the very beginning, it's saying he was analyzing patient feedback data and all the feedback is very, very positive. So this entire thing, this entire event over here is mentioned. Okay, we cannot say that it is not mentioned. This entire thing over here is mentioned, that is analyzing patient feedback data on the subject of communication. But what are we waiting for? We have to confirm whether this event triggered his interest. Okay, but that is not mentioned. It is not, they are not saying that this thing over here triggered his interest. That was not the reason. So we cannot choose answer option C. Right. So anyway, from answer option C, now your eyesight should go to answer option B. Because now what is answer option B telling? Answer option B is telling he was observing. Okay, he was witnessing the effects of communication on another patient. Right. So now your eyesight from answer option C it should go to answer option B, right? So this is how your eyesight should work when you're dealing with multiple choice questions. Now he's saying, I was in a hospital with another patient. Now see, that keyword is mentioned. With a patient, the option also has a patient. Witnessed, synonym, okay? Observe is the word over there. Here they are using synonym. Witnessed for myself. What can result when a healthcare professional assumes, okay, when assumes they have made themselves clear to a patient. Okay, so here he's saying he saw a healthcare staff and a patient having a conversation, right? But he's saying the healthcare professional assumed basically means what? Guess. Guess that they have made themselves clear to the patient. Okay, so the healthcare professional is believing that they made themselves clear to the patient, but this is not the reality. This is just an assumption. Okay, the healthcare staff over here is assuming that they have made their message very clear to the patient, when in fact, but this is the reality. In fact basically means what? This is the reality, they have been anything but. Okay, now this is advanced. Those who are little bit proficient in English language, they know what I'm talking, but those are slightly weak, they might have not understood the meaning. Anything but basically means it was everything but this. Okay, now how do I explain this? Hmm. Anything but bitter gourd. What do you understand this? Bitter gourd, so it is a vegetable. I'm not sure. I don't know. I don't know. Karela, I think so. In Hindi, we say Karela, and in Malayalam, we say Kaipakai and all. Right. So bitter gourd, right? So when you go to when you go to a restaurant, or when you're telling, your mother, mom, what do you want for dinner? So you will say, I will eat anything, but I won't eat bitter gourd. Anything but bitter gourd. Now, see, when you are praying, when you're getting an OET question paper, what will you pray? You will say anything but a difficult question paper. When you're praying, what will you say? Oh, I'm going to write my OET exam. Okay, anything but a difficult question paper. Anything. I will handle anything, but a difficult question paper, I don't want. I will eat anything, but a bitter gourd, I will not eat. So, but basically means apart from everything, okay, everything else is okay, but this one I don't want. Now that is the meaning over here. See, here the medical professional is assuming that they have made themselves very much clear to the patient, but in reality they have been anything but. That means that is they have not made them, that they have made everything clear, they have made everything else, but they have not made themselves clear to the patient. Okay, I'm doing the best I can. I hope you have actually understood what I'm trying to say. Right. Okay, so this is what anything but basically means. Now he is saying, luckily, I had a very few complaints made against members of my team, but the potential is certainly there. Now he's saying, luckily, I had a very few complaints made against members of my team. So he's a doctor over here. So very few complaints only he has received. But he's saying the potential is certainly there. Potential basically means what? Possibility. So there is a very big possibility that I will get a lot of complaints in the future. Now, this is where the elimination strategy really becomes quite easy. Right. Yeah. Yes, it's very interesting, and yeah, it is important as well. So, the OET, they kind of use these type of language. Okay, so you have to become familiar with these type of languages. Right. So now over here, let's talk about the elimination. Okay. So first, what was the answer option we covered? It was the verb over here was analyzing patient feedback data and everything. So the keywords are mentioned. Okay, the keywords are mentioned, the verb are mentioned. But is that the reason why he became interested? No, that is not the reason why he became interested. So even though it is mentioned, C will not be the right answer. Now, let's talk about answer option A. Now here, as an inpatient, so did he anywhere tell that he became a patient? That this doctor over here, that he got admitted into a hospital and he became a patient? No. It is not all mentioned that he became the patient. So if he didn't become a patient, how can he experience poor communication? So experience, that is the verb over here. So he did not experience any poor communication as a patient. So since that is not mentioned, we can eliminate answer option A. Now see, you may struggle with finding the correct answer, but at least if you're able to eliminate the incorrect answer options, then automatically you will choose the right answer. Now, what is the right answer? By default, B becomes the right answer. Now, is B mentioned over here? Observing the effects. So what is the verb over here? Witnessing the effects. So the same word is witnessing the effects of communication on another patient. And is this the reason why he became interested? Yes. So this is the reason why he became interested in this particular topic. That was the motivating factor, right? So we will choose answer option B. Now the answer of those over here, those who don't know, once again I'll show. So I was in a hospital with a patient and witnessed for myself. That is, he observed for myself what can happen, that when a healthcare professional assumes they have made themselves clear, that is, the staff is just assuming that they have whatever they have communicated, the patient has understood. But in reality, it is exactly the opposite. Anything but. Anything but basically means anything, everything else happened, but the clarity to the patient was not given. That's the meaning of anything but. It's a slightly advanced vocabulary. If you know this, in the future at least, you will not struggle. Right. So now I'm going to play the audio just once again. So before that, I'll just show you this document. Okay. So this question over here, so I'll share this document to you after this thing is done. So here you have to identify the speaker's motivation, right? So what type of question is this? This is a reason or motivation type question. It is asking you why or how something began, that is interest began. Such questions are testing your ability to identify the reason behind the speaker's interest, decision, or action. So in this case, what made Dr. Gardiner being interested, staff-patient communication. So again, how this is what I'm trying to develop in you, how to prepare yourself mentally for such questions on examination day. So when you see these type of questions in listening part C, first and foremost, you have to read the question. Again, comprehension of the question is very much important. And as I always say, you have to interact with the question paper. So underline the keywords. Okay, in the question, he first became interested. So your focus should be on when. So first basically means what? It is a timeline. So when did his interest begin? And then after, so it signals a cause or a reason. Okay, so after what event, okay, made him become interested? So this is a reason type question. Like this, you really have to get that clarity. Next is step number 2. That is, now you should predict what you have to going to hear. Again, now you have to be able to anticipate for the signal words. Okay, so he will say, I became interested. So you must be able to predict these type of vocabulary. It all began after I started looking into. So what event over here? See, I became in first means what? Beginning. Okay, so like this, you must be able to predict for these type of words. Then when you're listening, listen for experiences or events rather than general opinions. See, this is why knowing what to listen to is very important. So now you're listening, you have to listen for what triggered his interest, an event or an experience. So the correct answer will usually come soon after the topic is introduced. They will introduce a topic and now they will say why he became interested. And as I told you, do not get distracted by extra details. See, they're talking about data, they're talking about feedback, they're talking about a background information and all. So that is, they're just trying to, you know, distract you over here. So that's just an extra detail. So don't give that too much importance. So over here, I have made a small vocabulary. Now see, anything but basically means completely not, definitely not, far from that particular thing. Okay, so for those who have a little bit vocabulary issue, I made a list over here. So you can go through this document after the session is done. Right. So let's take a look into the audio once again, and then we'll go to the next question. Now see, all these things you have 24/7 access to these lectures. So make sure that you are utilizing it. Now, let's hear the audio script.
Good morning. My name is Dr. Keith Gardner, and I'd like to talk to you today about some research I've been involved in concerning something that affects all health professionals, staff-patient communication. Now, firstly, let me reassure you that in feedback, patients seem positive about the way information is communicated to them. But I recently decided to explore the issue in more detail when I was in a hospital with a patient and witnessed for myself what can result when a healthcare professional assumes they've made themselves clear to a patient, when in fact they've been anything but. Luckily, I've had very few complaints made against members of my team, but the potential is certainly there.